Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Prevention of the spread of infectious organisms is fundamental to operating room procedures. Large quantities of bacteria are present in the nose and mouth, on the skin, and on the clothing of personnel who enter the restricted areas of the operating room suite. However, when these personnel observe fundamental aseptic practices, spread of bacteria is avoided. This is essential for surgical patients since their wounds make them very susceptible to infection during hospitalization. The purpose of this program is to provide you with the basic knowledge of asepsis, scrubbing and gowning and gloving techniques as you begin to participate in surgical procedures. During the program, you will have opportunities to review the techniques. Since maintenance of asepsis is the basis for operating room procedures, it is essential that you have a thorough understanding of aseptic principles and techniques. You must apply these principles and practices instinctively. That is, you must develop a surgical conscience. The concept of sterility and the existence of a sterile field are essential to surgical procedure. Sterility exists when an object is completely free of all living microorganisms. When the principles of basic aseptic technique are followed, a sterile field is established by isolating the operative site from the surrounding unsterile physical environment. During an operation, the patient is considered the center of the sterile field. Additional sterile areas are grouped around the patient. All materials which have contact with the incision site and are used within a sterile field must be sterile. Whenever there is doubt of the sterility of an object or material, it must be considered contaminated and therefore unsterile. This demarcation between the sterile field and the remaining unsterile environment is often intangible. Interpretation of sterile areas versus unsterile areas requires careful observation and good judgment. You must rely upon your surgical conscience. It should guide you to respond appropriately in maintaining the sterile field by immediately identifying and correcting any contamination. As the environment within the operating room is divided between the sterile fields and the unsterile areas, so too the members of the surgical team are distinguished by the area in which they may work. The surgical team consists of those who scrub and therefore work within the sterile field, and those who do not scrub and must remain outside of the sterile field. As you participate in a surgical procedure, you will notice many members of the operating team perform their jobs from positions outside of the sterile field. It is essential that they avoid touching or reaching over the sterile field or allowing any unsterile item to enter it, since this would contaminate the field. To avoid accidentally crossing into a sterile field, these team members must keep sterile areas in view as they move. This means they must approach the sterile areas facing them and avoid walking between sterile fields. Scrub team members remain close to the sterile field. Whenever they change position, they turn back to back while maintaining a safe distance. Gowns of the operating team are not totally sterile. In fact, only very specific areas of their gowns are considered sterile. In front, from 2 inches below the neckline to waist level, and the sleeves. The back of the gown is not protected from contamination and is not considered sterile. The gown is sterile only in front to the waist level. In order to maintain sterility, you as a scrubbed team member must keep your hands and any other sterile objects above your waist. If you drop your hands below your waist, you must consider them contaminated. To summarize, close adherence to the principles of asepsis and consistent observance of the boundaries established by those principles provides protection against infection. It is your responsibility to prevent contamination of the sterile field whenever possible, and to correct any contamination which does occur. Your surgical conscience is developed by understanding and applying the principles of aseptic technique. In order to facilitate the development of your surgical conscience, Take a few minutes to consider how you would apply aseptic technique to the following situation. Where are the sterile fields? The draped patient is the center of the sterile field, shown here in the highlighted area. Additional sterile areas are grouped around the patient. Which members of the operating team work in the sterile field? The members of the operating team who work in the sterile field are those who scrub, including the surgeon, the surgical assistants, and the scrub person. What parts of the gown are sterile? The only parts of the gown which are sterile include the outside front of the gown, from about 2 inches below the neckline to the waist, and the sleeves of the gown. Which member of this team can no longer be considered sterile? The person who has allowed his hands to drop below the level of his waist can no longer be considered sterile. Whether you are a participant or an observer of a surgical procedure, you begin your practice of aseptic techniques by wearing clean operating room attire. Street clothes are not to be worn within restricted areas of the surgical suite. Before you enter this restricted area, your hair must be completely covered by a cap. You must wear a disposable face mask, clean surgical pantsuit or surgical dress, and your shoes must be covered by special shoe covers. Hair acts as a filter when left uncovered and collects bacteria which are released into the air during activity. So the surgical cap is the first item which you should put on after removing your street clothes. This eliminates the possibility of hair or dandruff being shed on your scrub suit. For this reason, it is very important that your hair be completely covered. Check your hair above the ears and at the nape of the neck to ensure that it is tucked under the cap. For those with a beard, the surgical hood provides additional coverage. As soon as your cap is in place, you're ready to put your scrub suit on. To do this, you should step into the scrub attire being very careful not to drag the pant legs on the floor. Never put the scrub attire over your head until your hair is completely covered by the scrub cap. The top of the scrub suit should be secured at the waist or tucked into the pants. Loose, flapping folds or shirt tails and baggy trousers are sources of possible contamination as you move because bacteria are freed by friction. Put on shoe covers next. The primary reason for the use of shoe covers is sanitation. When the same shoes are worn for successive operations, they provide a very high bacterial count with a potential for cross-infection. As a result, it is important to change your shoe covers between procedures. Clogs, sandals, and tennis shoes are not to be worn because they present a potential safety hazard. Wash your hands before handling or putting on the mask. Masking completes the operating room attire. Place the mask completely over the nose and mouth and tie it securely to prevent venting. The strings should not be crossed when tied because the sides of the mask will gap. The mask serves as a filter for the microorganisms which are expired from your nose and mouth. Consequently, masks should never be saved from one procedure to the next or left dangling around your neck. If you do wear a scrub dress, it is essential that pantyhose be worn in order to contain bacterial shedding. For the same reason, knee socks should be worn only with scrub pants. Pierced earrings may be worn but must be contained within your cap. You are now dressed and ready to enter the operating room. But before going on, take a moment to review the robing procedure. What must you do before starting to dress in surgical attire? You must remove your street clothes. What do you put on and in what order? Begin with the cap. Be sure to check your hair. Is it completely tucked under the cap? If you have a beard, you must wear a surgical hood. Next, a clean surgical pantsuit or surgical dress must be put on. Then shoe cover should be put on. And finally, a disposable face mask. The surgical scrub is an obvious part of aseptic technique. Through it, dirt, skin, oil, and microbes are removed from hands and lower arms, and an antimicrobial residue which prevents growth of microbes for several hours is left. A careful, complete scrub must be completed for each surgical procedure. All rings, watches, or other jewelry must be removed and secured to your scrub attire before the scrub. All nail polish must be removed. Turn on the faucet and bring the water to a comfortable temperature. You'll find that most scrub sinks have either an automatic control button or a knee control lever. Wash your hands, forearms, and elbows well with a soap tissue. Either the timed or the stroke method of scrubbing may be used, depending on the preference of the hospital in which you're working. In this program, we'll demonstrate the timed method. Properly done, this technique requires that you scrub for 6 minutes. Obtain a nail cleaner and clean under and around each nail. It is important that you clean all nails and subungual spaces. At this point, rinse your hands and arms thoroughly, being careful to hold the hands higher than the elbows and at right angles to the body. Also, avoid splashing water onto your scrub attire. Open a package containing the scrub sponge. The sponge contains antimicrobial soap. Moisten it and begin the scrub. All sides and tips of each finger, as well as the area between them, must be scrubbed. Keep in mind that each finger has 4 sides, and your goal is to maintain clean surface to clean surface. To begin, scrub the tips of the nails. Then move to the outer surface of your little finger. Then to the palm surface of the same finger, up over the tip to the back. And finally, the interdigital surface. Then proceed to the interdigital surface of the next finger. This sequence of interdigital surface to the back of the finger up and over its tip to the palm surface and onto the next interdigital surface is repeated for all of the fingers. Then scrub the palm and back of the hand. When properly done, the scrub on each hand takes 1 1/2 minutes. When you complete one hand, immediately scrub the other. As soon as both hands are thoroughly scrubbed, go on to the wrists and arms, including the elbows and antecubital space. This is done by using a circular motion. A word of caution, though. Those who are new to scrubbing sometimes move their scrub sponge back and forth along the arm. As a result, they move the brush from clean to dirty to clean areas, causing contamination. In contrast, a circular motion cleans the skin without retracing the scrub. It will take you 1 1/2 minutes to scrub each arm. The hands are always held above the level of the elbows and at right angles to the body while scrubbing to allow the water to flow from the first scrubbed and cleanest areas. You should also keep your hands and arms away from the body and surgical attire. After completing your 6-minute scrub, the sponge should be discarded in the proper receptacle. Then rinse your hands and arms thoroughly, allowing residual water to drip into the sink. If the sink you're using is automatic, it will turn off by itself. Otherwise, you will need to use the knee control. Do not touch anything with your surgically clean hands and arms. You are now ready to enter the operating room. Keep your hands and arms in view and back into the operating room. Before gowning and gloving, you must remove any moisture on the scrubbed skin with a sterile towel. When you obtain the towel, be careful that the dripping water from your skin does not contaminate the sterile field which contains your sterile gown. Grasp the folded towel firmly near the open corner and lift it straight up and away from the sterile field. Step away from the field and bend forward slightly from the waist. Your hand should still be held above your waist and slightly out from your body. Unfold the towel once and holding it with one hand, blot dry the opposite fingers and hand, making sure they are thoroughly dry before moving to the forearm. The forearm is dried with a circular motion following the same direction or path as the scrub. In order to dry the other hand and forearm, it is necessary to refold the towel so that the used contaminated area is now inside and the unused clean portion is outside. Unfold the towel lengthwise and, grasping its lower end, blot your skin. Discard the towel. To review then, how long is the timed scrub? The timed scrub takes 6 minutes, evenly divided between each hand and arm. In what position must you keep your hands throughout the scrub? The hands must be held higher than the elbows and at right angles to the body throughout the scrub. After you have finished the scrub, you must keep your hands in this position. What areas of the hands and arms do you scrub? You must scrub the tips of the nails, all 4 sides and the tip of each finger, the area between the palm surface and the interdigital surface, and finally, the wrists and arms, including the elbows and antecubital spaces. What basic principle guides the scrub? The basic principle of scrubbing is always move from clean to dirty skin, never retracing your motion. How do you remove any moisture left on the scrubbed skin? Moisture left on the scrubbed skin may be removed by the use of a sterile towel. Before the scrubbed surgical team members can touch sterile equipment or the sterile field, they must put on sterile gowns and sterile surgical gloves. As you look at the gown, you will notice that it is folded in half widthwise so that the inside front neckline of the gown is visible on top. Because the outer side of the front and sleeves of the gown will come in contact with the sterile field during surgery, the gown is folded so that the scrubbed person can put it on without touching the outer side with bare hands. Grasp the sterile gown below the neckline and lift it from the sterile field. Let it unfold, keeping the inside of the gown toward you and the armholes in view. Give yourself adequate space away from unsterile objects or surfaces, since contact with these would contaminate the gown. Hold the gown at shoulder level and away from your body. Before putting on your gown, you'll need to know whether you'll be using assisted open gloving technique or unassisted closed gloving. Slip both hands into the armholes at the same time, making sure to keep your hands at shoulder level and away from your body. If closed gloving technique is to be utilized, put your hands and forearms into the sleeves of the gown, stopping just short of the proximal edge of the cuff. If you're following open gloving technique, pass your hands completely through the cuffs of the gown. At this point, the circulating nurse will assist you in adjusting the gown and securing the neck and waist closures. You are now ready to glove. There are 2 techniques used in gloving, open and closed. The closed method of gloving has the advantage of preventing the bare hands from coming in contact with the outside of the gloves, which must be kept sterile. With the closed method, you handle the gloves through the fabric of the gown sleeves, pushing your hands through the cuff openings as the gloves are pulled in place. You should begin with a glove for your non-dominant hand. So if you're right-handed, the left glove is put on first. Use your right hand, still kept inside the gown sleeve, to pick up the left glove by its folded cuff. Lay it down on your extended left palm so that the thumb is down and the fingers of the glove are pointed toward your elbow. The glove should now be palm to palm and cuff to cuff. Next, with the thumb and index finger of each hand, hold opposite sides of the glove edge. Stretch and pull the glove over your knitted sleeve cuff. Grasp the sleeve and glove together as one unit, working your hand into the glove until your fingers and thumb are fully inserted. Make sure the wristlets of your gown are covered by the glove. Repeat the procedure for the right hand. Once you have finished gloving, the circulating nurse will help you to secure the sterile back tie of your gown by holding the protective tie cover. Turn in a counterclockwise direction. Grasp the end of the tie which is attached to the front of your gown and the end of the tie held by the circulating nurse and tie your gown. At this point, you should remove any powder from the exterior of your gloves. If you use the open gloving method, another gowned and gloved person will assist you by offering you one glove at a time. You'll be handed the glove for your non-dominant hand first. Put your hand down into the glove, exerting some force. Don't worry if the fingers of your hand and the glove do not correspond. You'll be able to adjust them after you have both gloves on. As the second glove is offered to you, use your sterile gloved hand to assist in stretching the cuff, but be careful not to touch the inside of the offered glove. Again, you will need to exert some force. At this point, adjust the glove until the fingers and thumb fit properly. Make sure the wristlets of the gown are covered entirely by the glove cuff. The circulating nurse will now help secure your gown. Now, let us review techniques of gowning and gloving. What part of the gown may be touched? The only part of the gown which may be touched is the inside, since the outer side of the front and sleeves will come in contact with the sterile field during the surgery. What gloving technique does this scrubbed person plan to use? This person is working without assistance, using the closed gloving technique. Which glove is put on first? The glove for the non-dominant hand is always put on first. How does she get the glove over her hand? She places the glove on her extended palm, thumb down, pulls it over her hand, and pushes her fingers through the cuff openings into the glove. How does she tie her gown? She turns counterclockwise, taking the protected tie from the circulating nurse, and ties it to the other end on the front of her gown. Gowning and gloving are now completed, and you're ready to participate in the operative procedure. Identify for yourself the sterile and unsterile fields, the scrubbed and unscrubbed personnel. This will guide you in maintaining asepsis. After the surgical procedure is completed, remove your gown and gloves before the surgical dressings are secured. These same steps should be followed if you must leave the OR during surgery. The way you take off your gown and gloves is very important, since you must contain the contamination of the soiled items and avoid cross-contamination. Untie the waist tie of your gown, and taking the gown shoulder seam, bring the neck and sleeve forward over your gloved hand without touching your scrub clothes. Do the same thing with the other shoulder. Once your gown is off, fold it inside out to contain its contamination and drop it into the trash container. Now remove your gloves by following the principle of clean to clean and dirty to dirty. Take either dirty gloved hand and touching only the dirty surface of the other glove, pull it off. With your clean ungloved hand, reach inside the dirty glove and pull it off. This method keeps your scrubbed hands clean. Scrubbing, gowning, and gloving are all fundamental to surgical procedures because they assist us to maintain a sterile environment. They are skills which you must develop, and they demand practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.